think Dr. Rajesh Ganesuni is there, and we will be talking about communication in ophthalmology. Over to Dr. Rajesh, please.
Good afternoon, everybody. I thank the Honorable Ophthalmology Society as well as the All India Ophthalmology Society for calling me to give this small talk on communication in ophthalmology. I'm Dr. Rajesh from Sudarshini Hospital, Guntur. I would like to acknowledge the inputs I got from Dr. Indu Arneja, the Director of the Indian Institute of Healthcare Communication, who has helped me a lot for this talk. So the question now is, why communication? There is a lot of demand from the patients now who wants to know more, because there is a freely available Google Doctor there, and there is a lot of explosion of information, whether it is correct or not, but there is an explosion of information in the internet. The patients wants to be explained more, they want to be given all the facts whether they understand it or not, and they want to participate in the patient care. They want to take the decision rather than we taking the decision. So now, am I communicating enough? Am I talking the right thing to my patients? Am I communicating well with my staff? Am I communicating well with my referring doctor? Am I communicating well with my other consultant? Is the question that we need to ask all of us. And the good news is that communication is easily learned, it can be easily acquired, and it can be easily modified. Now, it doesn't mean that a good orator is communicating well. According to the Indian Institute of Healthcare Communication, the right words to the right person is only 7% of the communication, and the rest of the 93% of the communication is the tone of the voice that we use and the body language that we have when we are uttering those words. Don't when the patient comes to your for your consultation, don't have a approach like that, watching your mobile phone or texting on your mobile phone or talking to somebody on your mobile phone. You should always have a positive attitude. Don't feel that the patient is a burden to you. Be happy that you're attending to the patient. There are so many doctors who are not able to get a proper number of consultations. You should be happy that you're attending to the patient, and show that happiness by way of your attitude towards the patient, and demonstrate your willingness to engage in a conversation to your patient. When the patient comes to you, greet them well, call them by name. This makes a lot of difference. When you call Subbarao Garu, please come, he'll be very happy that the doctor knows my name. And make an eye contact. Don't keep looking at your phone. Make an eye contact to your patient. Smile to them and listen to them attentively. Maintain an open posture. Lean forward. Pay attention and by nodding and smiling appropriately. Don't smile as you like. And use the appropriate tone, not rude or harsh or intimidating words, and use the right words with the right tone. Always allow the patients to express themselves. And of course, if the conversation is going away from the disease, slowly bring them back and take the appropriate information from them, and accept their emotional reactions without being too reactive yourself. Don't start crying along with your patient. Be comforting to the patient and their family. Show honest behavior that you understand how painful the patient is feeling, and show empathy to the patient. Patient sees your communication skills more than your clinical skills. That is why the unqualified quacks are more successful than highly qualified consultants. So your communication is very important. Answer to their questions and clarify their doubts properly. And we will be dealing with many elderly patients, and when we are dealing with this elderly patient, we should listen to them properly, allow the patient to speak, we should win their confidence, we should listen to their problems, we should develop a rapport with them, make them comfortable. Only then they will come out with the information that we would like to get for the diagnosis. So when explaining about their illness, first, make yourself available to the patient to explain about their disease, and tell them why did they get the disease and what can be done about the disease, what options are available, medical, surgical, what options are available. Put it on the table. Let them participate in the decision making, and give them the chance to choose the treatment modality, and give them the choice of whether they want to get admitted or whether they want to get it done as a daycare procedure. Involve the patient's family. This is also very important. Involve the patient family in the decision making. Provide them all the information. Facilitate in the decision making. Lead them to the appropriate safe decision. Be honest in that, and let them select what they want. Don't force anything. Finally, when you give them all the information, they'll always say, Doctor Saab, you decide what is the best thing. You are the best judge. So we should lead them to a good decision and a proper decision. So better communication helps in diagnostic and treatment accuracy. So only when the patient is comfortable and only when the patient knows that you're giving them the honest advice, they'll go for the investigations that you ordered for. It helps in the patient compliance. When they understand the disease, when they understand their treatment protocol, they'll be good patient compliance, and they get the investigations done according to your protocols, and they follow your treatment protocols, and of course they'll get the surgery done according to your advice. Not only communication with the for the patient helps in the patient safety right from the security, right from the patient enters your hospital, at the security level, at the parking attendant, the receptionist, the refractionists, the helpers, the pharmacists, the building departments, the different departments and the different teams. When they communicate properly, only with when there is proper communication between these different departments, this will reduce our medical errors. Most of the time, we should always remember the patient unhappiness starts at the parking lot and then ends up with a fight in your chamber. So it is always very important to display and respect the patient care at every step of your in your hospital. When the patient enters your hospital, we can reduce with good communication between the nurses, doctors, patients, and the residents and the patient's family. Errors can be avoided and reduce the chaos in the day-to-day hospital working. So better communication helps to reduce the conflict with the patients and their families. It helps to reduce the risk of medical negligence allegations, and it will help to reduce to gain greater patient satisfaction. Not only with the patients, we should be able to communicate well with our team. We should appreciate our team, acknowledge their input, give them more personal and professional satisfaction, which gives us more better name, fame, money, and the footfalls. One important thing is the time management of the patient. We should always give proper appointment. We should never make the patient wait unnecessarily. And we should know whether the patient is coming from 10 kilometers away or 100 kilometers away. There is no point in asking a patient who has come 100 kilometers away to come for a small investigation day after tomorrow. That will be very inconvenient for the patient, and attend to them properly. So also, very important thing is we should be able to communicate very well when we are referring our patient to some other higher institute. We should tell the patient. We should document, tell the patient properly why we are referring the patient, and also when patient comes for a second opinion, we should be able to tell them. We should be very careful what words we are uttering to the patient, because patient has come for a second opinion. We should always give that second opinion willingly. So finally, the good practice tips: build rapport, practice transparency, address the patient's concern, practice informed decision making, give realistic expectation, accept professional limitation, keep the patient and the family updated, communicate what you document and document what you communicate, and learn to control your emotional reactions. Thank you very much. Sorry for taking 1 more minute extra. Always be honest to the patient. See, you are trying to help the patient, right? For mostly the postgraduates, and see, when you're dealing with one patient, that one patient is your responsibility to work up that particular patient. Sometimes you want to leave the patient in the middle of an examination, go for something else. No, that is not the way. Honestly and sincerely attend to that one particular patient, because the rest of the 99 patients is not your responsibility. It is the responsibility of the consultant. The consultant has given you one single patient, and that patient has to be worked up very well. And always don't give your decision to the patient, because you may be right, you may be wrong. Always just do the investigations that your consultant has told you to perform for that particular patient, and give your result to the consultant, and that consultant will decide what to talk to the patient. Always being very honest to the patient is not also the right thing, because sometimes you may not know what is going to be the repercussions later. So you give your this is for the postgraduates. You give your results to your consultant, and the consultant will decide what to do, and they will give the appropriate treatment to the patient. I hope that I answered
Yeah.
that.
Okay, Dr. Rajesh is really nice presentation, and these communication skills applies even to for all the departments. In
Everybody.
fact, not only ophthalmology, any department, any faculty. So these are all very important, and we really appreciate for your